Remember the first few weeks of the nationwide lockdown, being completely restricted to your home, only stepping out for the bare essentials? Now imagine falling sick or having to undergo treatment under a nationwide lockdown in a global pandemic. October is observed as Breast Cancer Awareness Month, and so we the People, we're dedicating tonight's show to the brave hearts and their spirits, breast cancer survivors and their family members, their caregivers, and their tales of triumph against cancer in the middle of a global pandemic. Shilpi Srivastava first joins us. Her mother-in-law was diagnosed with breast cancer in July 2020 in July. And the patient, her mom-in-law, Nilima Srivastava, cannot join us. She's on a drip right now. She's unable to speak. So Shilpi, her daughter-in-law is, as she is supervising the treatment. So Shilpi, your mom is lucky to have you. She was diagnosed in July. How did you all navigate, the initial shock? Because facing a breast cancer diagnosis is a huge challenge in itself. Being diagnosed during a global crisis like a pandemic just adds layers of the complexities to managing the disease. How did you navigate this? What's your story?
My story is like in July 2020, we came to know that my mother has a little, tumor in her breast. So we just first we thought that we will shift her into Delhi and हम वहाँ पे treatment करेंगे. But second, due to Delhi condition in the July, we dropped that plan, and we then of course the second option will be Lucknow. And I just little Google about the breast cancer, experts, and think which doctor we need to consult. So I came to know about Dr. Vibhor Mahindru. So हम लोग फिर उनसे मिले, उनसे बात किए. He counsel us so well. He tell me about each and everything. After operation, after chemo, each and everything. The best part is we got a right doctor, and the worst part is this COVID situation. But you can say that this is the blessing in disguise. Due to COVID, we are in home. हमारा सारा ऑफिस रिमोटली चल रहा है, तो ये टाइम मिल गया मुझे अपनी मदर, हम सबको मिल गया कि मम्मा का अच्छे से केयर कर सकते हैं, डॉक्टर को दिखला सकते हैं.
That's the silver lining. You've managed to bond, and she has all of you, her family with her. You and your husband, I think, from what you're saying, have moved there in Lucknow, and you're working remotely, and you can be with her. That's wonderful. But आप कह रहे थे आप सब कुछ remote कर रहे हो, फिर भी आप कह रहे हो कि आपकी मम को she's undergoing chemotherapy. तो वो कैसे होता है? क्योंकि कीमो के लिए तो उनको जाना पड़ेगा हर 21 days or so, I think. तो वो कैसे करते हैं?
हर 21st डे पे आवर बेस लोकेशन इज इलाहाबाद, तो फिर हम हर 21st डे पे हम इलाहाबाद से लखनऊ आते हैं, फिर ड्रिप चढ़ाते हैं, देन कीमोथेरेपी का ड्रिप चढ़ता है जो मेडिसिन होती है, देन फिर हम बैक होते हैं. बिकॉज इस टाइम पे आई कैन टेक अ चांस कि आप होटल रिकमेंड कर सको या हॉस्पिटल्स भी, दे आर वेरी मच इन दिस जोन. So we just managed कि हम लोग comfort.
तो फिर भी it's a long. So how many hours is the trip?
It's approx 6 hours. 6 hours.
तो एक दिन में आप 6 घंटे ड्राइव करते हो, आप you undergo the chemo और फिर वापस you bring your mom-in-law back. Wow, she is a brave lady. You all are, the entire family. Thanks so much, Shilpi. We have Dr. Krishna Kumar Ratnam, the head of the medical oncology at the Meenakshi Mission Hospital in Madurai. And at your hospital, doctor, you're saying and your colleagues are saying that there has been a sharp decline in the number of breast cancer patients seeking treatment in the initial 5 months of the COVID-19 pandemic-induced lockdown. Doctor, can you hear me?
Yeah, I can hear you.
I wanted to ask, at your hospital, you have noticed that there has been a reduction in the number of patients visiting healthcare facilities because of the fear of contracting the virus, because of travel restrictions. Is that correct?
Yes, there has definitely been a decrease in the number of patients seeking treatment for cancer. However, this was during the intense lockdown period, and then even during the period with the available e-pass within districts, we've been able to cater to at least about 60% of the patients. But of course, as you said, there has been difficulty amongst certain patients to reach hospital for cancer care.
So then what is the impact of delayed treatment on morbidity, on mortality rates of breast cancer patients?
Yeah. So to give you a very bird's eye view of breast cancer as a whole, to put it in a nutshell, breast cancer, if diagnosed earlier, is more curable. And that's a world known fact. So when a patient comes to the hospital delayed for, at diagnosis for various reasons whatsoever, we are going to diagnose them at a much later stage. And this has been the picture even before lockdown, because it is known, the statistics say that in India about 50 to 60% of the patients do present to us only at stage 3 and beyond. And that does bring down the cure rate of breast cancer. And this has just been, this effect has been compounded forward with the corona pandemic.
So it's gotten worsened, and you're saying breast cancer is one of the more curable cancers, but it needs to be diagnosed at an early stage. So especially particularly for breast cancer, it's important that someone comes up.
Yes.
Okay. Do we have Reena Dhaka? She needs no introduction. All right, Reena Dhaka, we'll try and get Reena Dhaka. She's a super successful fashion designer, of course, as we all know, a mother and a breast cancer survivor. She will be joining us in a bit. Let's go across to Ruchi Dhawan, who joins us. She's also a breast cancer survivor who has beaten stage 4 breast cancer, living a full life now. Thank you, Ruchi Dhawan, for joining us. Your cancer has relapsed twice, though it's controlled over the years, but you have to have regular scans, I'm assuming. आपको रेगुलरली स्कैन्स करने पड़ रहे होंगे, तो आपने आखिरी स्कैन कब की थी और वो एक्सपीरियंस कैसा था आपके लिए?
Last was in August 2020, and every 6 months I get my scanning done. So because of that scanning only, it was discovered in the last 2 times when it was relapsed. So that is the case. So now it's a part of my life, so I don't feel anything special that I have to go for a scan.
So you say every 6 months you have to go for a scan. So this would have been under this lockdown period. What was that experience like? Having to balance out the fears of contracting corona and against the high risk of cancer progressing if not treated appropriately or not spotted. Did you juggle with that? Did your family worry about that? Did you choose to prioritize?
We were a little worried, but we had faith in the hospital that they will be taking good care of everything. And that was the case. As we went to Max, everything was taken care of. So didn't face any problem. Everything was very nicely sanitized and everything was separate. So didn't feel itching there. Before, I was little, you can say I was little skeptical that I would not go. I would get it postponed, but then I got it done.
That. Now, cancer, you've said that cancer runs in your family, right? And yet you have said that when you initially found out that you had breast cancer, you were delayed going to a doctor due to, I don't know, job pressures, you had to take care of your kids. Is that true?
Yeah. Actually, it was some other family member was also very unwell in a coma kind of situation. So many things happening in the family. So I kept postponing my checkup, and that happened. So that is why it reached, I think, stage 4, and that is the main message that I want to give through you, that please, every lady, please, your family is important. For that sake, please don't postpone your checkups and be regular in your checkups, because then only you will be able to take care of your family properly. So you have to be very healthy to take care of your family. That is the main message that I would like to give.
So we have to focus on the health of the caregiver too. Dr. Meenu Walia, as Dr. Krishna Kumar was saying, breast cancer, one of the most curable cancers, but diagnosis at an early stage is crucial. And often, as we hear here, women put their own healthcare needs on the back burner. What could be the result of a missed screening, delays in diagnosis, reductions in oncology care caused by COVID-19 pandemic?
I couldn't hear the first part.
I was just asking what the results could be if one has to, has a missed a screening or a delay in a diagnosis.
The result can actually have a lot of implications. Cancer is one disease where early diagnosis makes a lot of difference. The earlier the stage you are diagnosing the disease, better is the prognosis, less is the cost involved, and it actually means life or death. And what has been happening during this COVID, not many patients have.
All right, Doctor, just hold that thought. We can't hear you very well. So let me just try and fix that with our tech team. But we have Reena Dhaka. Then let me ask Reena the same question. Reena Dhaka needs no introduction, of course. Super successful fashion designer, a mother and a breast cancer survivor, juggling all of these balls in the air. Reena Dhaka, women often put their health needs somewhere on the back burner. It falls somewhere low on the checklist of things that need to get done during a day. What would your advice be to women, pandemic or not? Can one put the issue of a regular breast checkup on the back burner? Because people are nervous about going for non-essential health care to hospitals, to doctors for checkups.
See, to be honest, I'm one of those who myself would put this on a back burner, and I did do that in my life. And I really feel there's not much we can do to change the nature of the beast. I mean, essentially, as women, as caregivers, we will put ourselves instinctively last. However, it would help with peer groups, families, who would push the women in the house to take these tests on regular basis. If more awareness can be created on the importance of this, to sensitize families, especially the male members of the family, that it's important that they get their wives and the breast checkups done. Because I do know there is a lot of hesitation even in today's date in many families where they don't want a male member to, be seeing a woman's body. So how to make this reach out, because it's not just located in urban areas of India, I mean all over the world, of course. It's also a lot in the rural India, and there is a lot of stigma, hesitation about going to doctors, about being self-obsessive. So these are issues which women will have to face in families. So I would say that the support of a family, the male members, is essential, wherein they encourage them and push them to go for these checkups. And also I think the checkups need to be made very easy and door to door, instead of having them so complicated or expensive sometimes.
I think that's a great point. I'm glad you raised it about informing and educating the male members of the family to also look out for their partners and their health checkups. Let's try Doctor. Let's try and get Doctor back on. Dr. Meenu Walia, COVID-19, as Reena Dhaka is saying, is a long-term problem. It's likely to stay with us in the near future. It's important to educate not just the women about neglecting their non-COVID health conditions, also men, but it's also important to ensure the continuation of non-COVID services in hospitals, which also induce confidence in people about the safety of hospitals and OPDs. Are there enough protocols and processes in place in hospitals to avoid the risk of infection? Because everybody worries and thinks that, hospitals are a cesspool of infection. Is that true?
Yes, at initial times, when COVID started, there was a lot of hue and cry. The processes and protocols had to evolve and were not in place. But today, in today's date, most of these hospitals have their processes and protocols in place, and people do not have to stop continuing their care for other diseases. It is very, very imperative that the care continues so that the other diseases are also taken care of.
Okay, sorry, again we seem to be having this trouble with the Meenu Walia. Dr. Krishna Kumar, could you respond to that question?
Yeah. It is true that hospital atmosphere can be a risk for cancer patients. But see, what we have followed in our institution, we have clear checkpoints. So what, and which most of the hospitals have followed of late. So there is a clear triage system where the cancer patients are, triaged separately, and then they are screened for various symptoms of fever or COVID, and then they are only once they are fine, they are let into the outpatient, and then the usual norms of social distancing, all these, and where they are seated and how appointments are given. And one very good move which most hospitals have utilized over the last COVID pandemic is the teleconsultation. Just as one of our friends who is a cancer survivor was talking about the apprehension of coming and getting herself tested. This teleconsultation helps these patients a lot, because most of the times if they are asymptomatic and they have no problem, and although there is a check date that comes sometime, say in the middle of the month, and it's a peak pandemic, they can always delay their checkups, and then they can get all their consult done through teleconsult, so that minimizes or probably makes the risk of cancer, the COVID infection minimum. So I think all hospitals have had this in place so that they can facilitate least transmission of infection to cancer patients.
So perhaps one of the positive fallouts of this pandemic, the push that technology has given, that could possibly make health services more accessible to all in the country. Neeja Malik joins us. She is a 2-time survivor of breast cancer and now works as a counselor. Neeja, thank you. Cancer certainly pushes the individual and their families to the limit. The mental health of the patient and their families, with everything happening around us, cancer patients get overwhelmed, their families get overwhelmed with diagnosis, treatments, consultations. Mental health is already an issue in a pandemic. So then you have to deal with cancer and the pandemic.
Okay. So let me, just clarify a few things. I tell people that corona is not going to wait for cancer. Cancer definitely will not wait for corona. So I'm in a very good space in Chennai. We have a good hospital called the Apollo Specialty Hospital where I was diagnosed. And that is where I started the Apollo Cancer Support Group in 2004 on the 8th of March. Now, my patients, and I'm counseling a lot of them, are still going to this particular hospital because the Cancer Specialty Hospital ensures that there is no COVID patient there and the treatment has to go on. So your diagnosis, your surgeries, your chemotherapies, your radiations, just carry on. And one thing that I do is, apart from counseling the patients, I also counsel the entire family. Now,
so let me ask you.
Let
me ask you, Neeja, that we do so many shows on mental health, right? And we talk about mental health, a huge, serious problem in India, and the fact that when you are feeling stress, depression, any of these issues, they say go out, meet a friend, get a coffee. That now you can't do in a global pandemic when you're under lockdown. What about when you're surviving cancer, undergoing chemo, expecting visitors, friends to come and cheer you up, and that's not possible?
All right, I'll tell you one thing. I am friend, I am counselor, I am family, and I am the loved one of many of my patients. So I send them positive thoughts. There are about 50 videos of mine on YouTube, and I tell these patients, for your mental health, you will not go to the net. It is prohibited. But yes, the only time you can go there is if you want to look up Neeja Malik on Google, hear her videos on YouTube.
All right.
Because I know one thing, that I will never say anything negative.
All right.
There has to be positivity.
Reena Dhaka, your thoughts on the mental health aspect. I know that the industry that you're working in, so much change, fashion shows going virtual, everybody trying to deal with change in their professional lives and their family spheres. And then you have to deal with cancer. Again, as I was asking Nija, the fact that, you may not be able to meet with people, interact with people, your loved ones need to stay away. In terms of mental health, what toll do you think this pandemic plays on patients?
So, pandemic is varied, I guess. When I personally believe that if I get afraid, I will attract it to myself. So the more I will fear my disease and the possibility of getting it, the more I feel my chances of getting it are. And so the whole thing is like, I chant, I'm a Buddhist. I really had to work on myself. So for me, pandemic is one issue, because I feel in pandemic, you may recover. But in cancer, the recovery is the dread. I mean, you do recover because of will or whatever. Some cancers recover, some don't. And there can be very varied stages of terrifying, because there is a stage where you're told you will get okay, your recovery rates are high, you can go back to normal life. But there are many people who keep having recurring cancers, and they have really had to deal with a lot of mental preparedness to be able to counter such a situation. I know so because of one of my friends who I recently lost to cancer. And I feel it is varied. It's just like the cancers are different for different people, your reactions are also going to be different. And how you deal with it also what cancer you have, what stage you are, will you recover, are you going to get it again? Then, of course, financial support groups, all these factors will play a very big role in helping you cope with it. And mental health, like the doctor is counseling, she probably knows of, ways which can soothe or help a person get by it, because fear of the unknown, fear of recurrence, the pain of the treatment, they are very, very deep fears one encounters, and you have to tackle them. And there is that constant thought you can get sometimes. I remember I used to get, is like, why me? You would have doubt, feelings of self-pity. And you have to really change that. You have to work on yourself, and also to not make it so obsessive, because sometimes, you can wallow in that self-pity and become very self-obsessed as an individual. And so these were my challenges, and I really, I thank the fact that I know how to chant, I could meditate, and I was able to have this day where I can talk about it without having a teary feeling at the back of my head.
Well, thank you all for sharing your stories so openly, so candidly with us. While coronavirus is a serious pandemic, it must not make you neglect your overall health, compromise in your regular checkups and doctor consultations, or delay cancer treatment. Thank you all on that note for joining us and helping put some light on this issue. We'll see you next week. Bye-bye.